Orthostasis is a common problem in a few different disease states. Going to run you through some common causes of orthostasis, whether that be medical or medication related. So what is orthostasis? First off, it's a drop in blood pressure with position changes. And how it impacts patients clinically is it can definitely substantially increase that fall risk. So contribute to dizziness, syncope, fainting, those type of episodes. And essentially any blood pressure lowering medication can contribute to orthostasis. So it's just an important side effect to keep an eye out for. And a question that I often ask patients is, do you feel significantly dizzy, upon rising? Positional changes, where you go from sitting to standing. And does that lend toward the problem of potentially falling, where you get so dizzy that you have to basically sit back down again? That's an important thing to remember. And then we can also assess that blood pressure and see, do sitting and standing or laying and sitting type blood pressure readings and see how much it's dropping with those position changes. So causes of orthostasis, tons and tons of causes. Dialysis, as far as from a medical perspective, dialysis is a big deal. Parkinson's is kind of another classic example where the medications itself can do it, some of the dopamine agonists, but also the disease state itself, it can happen. Dehydration, another kind of example there where maybe we don't get that adequate blood flow perfusion to the brain. As far as medication causes, so I mentioned the kind of the antihypertensives. Particularly, you may see a little bit higher risk of orthostasis with the central acting alpha-2 agonists. So, kind of the older drugs like clonidine and maybe a methyl dopa. Alpha blockers, those maybe tend to be a little bit more orthostatic in inducing, or more greatly increases that risk versus other antihypertensives. And if we think about that, we do maybe have a little higher risk there, and alpha blockers are generally not considered first line as far as blood pressure lowering effects. Now, if you've got a situation where you've got BPH and hypertension, then it might be advantageous. PDE4 inhibitors, so things like Viagra there, sildenafil, those can cause some orthostasis. All other blood pressure medications definitely can cause some orthostasis as well. So just a few common examples of drugs that can contribute to that drop in blood pressure with position changes. So as far as management of orthostasis, we look at those blood pressure medications and, can we remove one, reduce one? That's really our first line management of this. Also, patient education. You've got to get up slowly. You've got to pay attention. Give your body time to, there's baroreceptors time to adapt to that position change and that blood pressure change with that position change. Fludrocortisone is an option you may see used. As far as side effects, it is a corticosteroid type medication. GI upset, edema, adrenal suppression, immunosuppression, generally longer term issues if we're using that drug in the long term. Midodrine is an alpha agonist, so it can definitely raise blood pressure and may exacerbate a BPH type situation. So those are kind of the two classic medications when we fail with doing the non-drug interventions, or when we fail changing antihypertensives.